A bunch of guys saved my life today, dressed in blue, green and any colour in between. They wore masks and visors too. I could have died tonight, but angels with tired eyes saved me.
They're powerful words for someone who is so powerless. Denise wrote them here in intensive care when she realised she may not die after all.
I can't thank them enough for what they've done. They are angels, every damn one of them. And I spoke to a nurse and I said, if money was no object, what would they want? And all they said is the end to COVID.
I normally work in the leisure centre. I'm normally a fitness leader.
Zoe now makes up some of the staff in intensive care. With double the number of critically ill patients, the hospitals had no choice but to call in volunteers to help.
You're totally out of your comfort zone, aren't you?
I am.
What made you volunteer to do this?
I know the help that's needed here, and when they gave me the opportunity to do it, I just jumped at it.
And it's not just council workers. Some staff here are now army personnel.
We've heard of staff being redeployed from other areas of hospitals, but this one has brought in 18 army medics to help them out. Along with the volunteers, they are doing everything they can to keep their patients safe and well cared for.
At the moment, the pressure in the West Midlands is as high as in London, so we're not taking any further patients in.
The hospital has taken 9 patients from London in the last few days, but that now has to stop. As I talked to Dr. Kreuper, someone had to be transferred to Manchester to make room for an emergency admission. This place is full.
We are cancelling urgent operations every day because we have no space on the critical care unit. So it's not just the COVID patients that are dying as a consequence of COVID, but also some patients who have urgent operations cancelled. Some of them will be so poorly that they will probably die as well.
That's it, just relax.
The only way to ease pressure for staff and reduce deaths is to get the vaccine into as many people as possible.
Just put some pressure on there for me. All done.
Tracy's the CEO here and has already vaccinated hundreds herself.
It's been all hands to the pump, really. It's something that I view as incredibly important. So we have been diverting some of our resource, and if that means us rolling our sleeves up to get stuck in, then we absolutely do.
Staffordshire's 2 largest hospitals have seen a quarter of their COVID patients die. The UK has now recorded its highest daily number of deaths so far as patients continue to arrive here. The death toll will just keep going up. Emily Morgan, News at 10 at the Royal Stoke Hospital in Staffordshire.